Welcome to the Heal, Thrive, Dream podcast, where trauma survivors become healthy thrivers. Each month, we'll feature a theme in the trauma recovery and empowerment field. To promote your recovery, healing, and learning how to build dreams, here's your host, Karen Robinson, transformational coach and therapist.
Are you a woman on a mission to uplift the lives of other women through your business? Do you have massive value to bring, and yet you still have difficulty gaining new clients? If so, join me, Katarina Rando, at my next free virtual workshop. I show women how to sell authentically to achieve sales bliss. Visit katarinarando.com/links to sign up for my next free workshop and gain many additional business building resources. Ding, ding, ding.
Welcome to the Heal, Thrive, Dream podcast. I have a very delightful guest today. Not only is he a very well-known doctor, but he is also a summit speaker for the upcoming summit on May 30th. We're going to be talking about trauma and the impact on the body, physical effects of trauma. So I am introducing Dr. Robert Smith. He is a seasoned physician and thought leader. He is sounding the alarm. Medical doctors need fundamental training in mental health care. He has a new book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and what should be done to cure. This book not only exposes the problem, but also lays out a bold, practical roadmap for reforming the system and saving lives. Dr. Smith, thank you for being my guest today.
Oh, thank you for having me.
I'm guessing that you've had 0 patients with a trauma history.
Many. And what we find is that the more you ask about it, the more you find trauma in the history. People often don't volunteer it right off the bat, but it's frequently there, I must say.
Yeah. The same. Most of my career has been as a mental health therapist, and I started asking more questions about physical health problems. And then I started making connections before. I didn't learn this in school. I learned that my trauma survivors had a lot of migraines. And then I learned that a lot of them have fibromyalgia. And it just went on and on. The trauma can impact every single area of our body.
It sure can. No, it's one of the things for people who have refractory physical complaints, particularly the more severe ones. It is critical that doctors ask about any trauma. And it has to be done in a sensitive way. You can't just flippantly ask, have you ever been abused? But you have to first establish a strong doctor-patient relationship using good communication techniques and being sensitive to the issue you're raising. And then you can indicate to people that it's very common in patients with these kind of refractory long-term physical health problems. And it's surprising how much trauma there has been, that it's just all we recognize right now is the tip of the iceberg. It's present in as many as 60 and 70% of people.
And those are the ones that will share when asked.
That's right. Yeah, studies have looked at this and have investigated with careful questioning and sensitive questioning and so on. And that's where these data come from, in nice survey studies that corroborate what you've observed.
So we all know that doctors, especially with managed care, don't have a lot of time with patients. So how does one establish rapport and trust with such little time?
Yeah, no, it's difficult. And the skills required for effective communication is what we call patient-centered interviewing. But the skills required for this are often counterintuitive. Doctors have been taught simply to just ask questions. Patient-centered skills allow the patient to have some room and lead the conversation and accordingly establish a strong relationship. But the problem is most doctors have not been taught about this and simply proceed by asking one question after the other, typically looking to see if there's some physical disease going on. And so it gets completely away from what the patient might want to talk about. If they felt depressed, or if they'd lost their keys in the waiting room, or if their husband was having trouble on the job, and whatever it might be. But the doctor typically goes straight to, have you had pain? Where is it located? Where does it go, move to? What do you do to relieve it? And those sorts of questions. What medicines are you taking?
As a complex trauma survivor myself, I noticed that zero of my doctors in the past asked about my traumas. And when I would happen to share it, they didn't ask me any follow-up questions about
Yeah,
it. I do have a good doctor now. And
yeah,
so I tell my clients all the time, if your doctor is not compassionate and caring and gives a damn about you, it's time to look for another. Would you agree with that? What would you say to patients?
yeah. But give your doctor a shot. Doctors,
I'm
you have
quick
to
to cut
remember,
off.
haven't been trained in this, and it may take you pushing it a little bit. For example, saying, "No, I want to talk about this, Dr. Jones. I've read about trauma in the past, and I've experienced so and so when I was in school." And just most doctors are very good, decent people. They just have not been trained in this material. And if you present it to them assertively, say, "I want to talk about this," they will do it. And again, if they don't, after giving them a good shot like that, then I would see somebody else.
You're right. You are such a fair dude. Thank you for saying that. Yeah. I think my frustration comes in a lot of complex trauma survivors don't know how to assert themselves
Yeah,
until they have a therapist like myself or a doctor like you to teach them that.
yeah. No, it helps. Just practical skills. Identify before you get to the doctor what you want to talk about, and then number them. Number one, number two, number three. And then when you see the doctor, and again, it's hard for people that maybe aren't assertive inherently. They've never been taught to be that way. But bite the bullet and say, "Doctor, I'd like to talk about X, Y, and Z." And order them. Most important is, and whatever that would be. But these are useful tips. Doctors often come on very hurried. They want to get down to the basics and so on. And you have to just interrupt that. They actually, most of them like it when you do that. It helps them focus on what they're going to do that day. So it does require being assertive, but it helps to plan ahead. What's one,
Yes.
two, and three you want to talk about, and then see that it happens.
Yes. That's a tool I give my clients too. A lot of times, sessions before a doctor's visit, we set up a plan. Like, okay, let's list the symptoms you're having. Let's list some of the family history the doctor
That's
should know
right.
about. Things like that, what your meds that you've tried to be more organized so they can present their issues succinctly,
That's
right?
right. That's right. No, and doctors will be responsive. Unfortunately, doctors just aren't trained in this material. And it's a sad commentary. In fact, that's what my book, Has Medicine Lost Its Mind, is about and why it's happened.
Yeah. How did you get interested in your patients' mental health and their trauma histories? How did that happen?
Yeah, I was in practice. And while I had been in training before that, we saw nothing but physical disease problems. And I was really unaware of all the psychological and mental health problems there were in practice. But when I got there, I was just floored with how much of it there was. And the next step was realizing how inept I was in handling these patients. And they could be people with chronic pain, or they could be people with depression or addiction. And I had no clue of what to do with them. And long story short, after I worked on it on my own for 7 or 8 years in practice, and then realized I still couldn't master it. And that's then when I went back to the University of Rochester and took special training in biopsychosocial medicine. And I've been doing that ever since then.
And can you share a little bit how that changed your practice?
Yeah. Oh, heavens. You have to first realize the patient must be allowed to take the lead when you're talking to them when they come in. That's what we were talking about earlier. And hearing that and then being able to respond to it. When a doctor does that, we hear about their personal lives and the things most interested them. Oftentimes, given that mental health conditions are the most common health condition in the US, they affect something like 1 out of 4 people. It's something nearly 100 million people have a mental health disorder. When you listen to the patient and draw them out, you pretty soon realize they have a common mental health disorder: depression, anxiety, addiction. And having recognized that, they then need to be treated, and treatment can be very effective. The problem in US medicine is that medicine and medical schools do not train doctors to address these mental disorders. And that's why I've gone public, as it were. It's why I wrote the book. is that medicine is not doing anything about that. They know the problem, but yet they still train doctors. This is across 4 years of medical school, 3 to 5 years of residency, some 12 to 15,000 hours of training. Only 2% of that is devoted to mental health care. And of that, it's mainly a 5-week experience in the 3rd year of medical school in psychiatry, where they see people with psychotic disorders, personality disorders, refractory addictions, completely unlike the patients they're going to see in practice. And so that's 3rd year in medical school. They get 0 from there on out through residencies. Most residencies don't provide any mental health training. And so your doctors are going out into practice where 50% of their patients are going to have a mental health disorder with no training whatsoever to handle that. And the downside of this is just disastrous. People with mental disorders that are not recognized and effectively treated, and we know there's effective treatment, this leads to suicides. There are 48,000 suicides a year. Half of these people see their doctor in the month before they commit suicide, but the doctors aren't trained in suicide. Potentially all of those could be saved. Prescription opioid overdoses, there's still something like 16, 17,000 a year. These are all done by untrained doctor prescribing opioids for chronic pain for which they are not trained. And it gets even worse, all this unrecognized mental disorders, divorce, school failure, job failure, homelessness, addiction, incarceration. Now, I'm not claiming that if doctors were trained, all of this would be cured, but a significant majority of these problems could at least be effectively addressed, and some of them prevented altogether. And as I said, don't blame your doctor. They're not trained. And if you talk to one of them or any of them, I just did a couple of meetings, and one of them told me, Bob, there's no psychiatrist in my town. Another one said, we've got 2 psychiatrists. It takes 9 to 10 months to get a patient in to see them. And so the point of this is that this idea that psychiatry is going to take care of all mental health problems in the US is just nonsense. They see only 12% of all mental health patients. Psychology sees another 12 or 15%, but the rest of it, the remaining 75%, is seen by people just like I was, untrained in mental health. And so the solution is simple: train the doctors who are providing the care. But medicine doesn't do this. And this is why I'm going to the public with this. The public needs to be informed of how bad their mental health care really is and how refractory medicine is to doing anything whatsoever about it. And I'll stop there. I could keep going, but
You said something interesting. Maybe there's a better way to say that. You said that patients should not blame their doctors. Who should they blame, or is this a blameless issue?
yeah, it's not blameless. It's medical, it's medicine itself, organized medicine, and in particular, medical education. They are the ones that decide doctors receive no more than 2% of all training time devoted to mental health, even though it's the most common health condition there is. Now, how could medicine be so stupid as to not train, pardon me for saying that, but
It's okay.
as to not train its doctors to care for the most common health condition they face?
It makes no sense, right?
Has medicine lost its mind? That's where the title of the book comes from.
But why are they so resistant to teaching doctors about mental health, trauma, nutrition? I heard is another issue.
That's the key question, Karen. And it goes clear back to the scientific revolution in the 16th and 17th centuries. Basically, what happened back then was that the scientists and the philosophers like Descartes compromised with the church so that the church handled all mental problems, head problems. That's the source of the soul and the spirit. Medicine got the rest of the body from the neck down. And that set it off on this course. It's called the mind-body split. The mind goes to the church, the body goes to medicine. They're split. And medicine and medical education have been focused that way ever since. It was highly effective. It's why we've had all these dramatic changes you read about, we experience every day. Heart transplants, kidney transplants, genetic analyses, the genome, all sorts of things, MRI machines that can tell us everything about the physical body. There was benefit to this mind-body split. And life survival increased from 40 years in 1900 to nearly 80 at the end of the century. But the downside of the mind-body split was that it did not address the new population of patients medicine saw. Mental illness then surfaced as people got older and mental illness became more apparent. And chronic diseases came up. Now, you might ask, why is chronic disease? That's medicine's strength. How is it shortchanged by the mind-body split? Medicine not only excludes mental health issues, it excludes all psychological, social, and emotional issues. These very psychological and social issues are what cause most chronic diseases: smoking too much, eating too much, not exercising, what have you. And medicine does not address these. Doctors do not address these in treatment, nor does medicine address them in prevention. We know that 80% of all heart disease, strokes, diabetes can be prevented, but medicine doesn't address it. It simply waits for the disease to happen and then treats it. But the problem is that patient's already had a stroke or a paralyzed, or the diabetes has affected their eyes, or they can't breathe because of their emphysema. Why not prevent all of that 30 and 40 years before that, so that patient retires healthily and happily?
Yeah. This discussion is so crucial because everything's so connected. I haven't met a depressed or anxious client that didn't have trauma. It can happen family history, but it's really rare. Like most of my clients with trauma have anxiety, depression, or both usually, and
Exactly.
post-traumatic stress. Yeah. So it's all connected. I don't think
It
it's a
is.
good decision anymore to have our head cut off from our body. I don't think it's good.
That's exactly, you framed it very accurately. The head has been cut off from the body. And everybody knows just intuitively that the mind and the body go together. There's no question about it. And yet medicine refuses to address this very obvious problem. That's why the public needs to be informed. The public needs to get angry and induce their politicians to do something about this. And the something that needs to be done is to conduct an investigation of all U.S. medical schools to see how well they are teaching a broad systems-based approach. And a systems approach means that all parts of a problem and their interactions, I think I'm showing up my hands here, all parts of the problem are considered, rather than just one part of the problem like that. All sciences, except medicine, have adopted this systems view since the turn of the last century. Only medicine continues to look at just one part of the problem. That is the physical disease part, and excludes the psychological and the broader social dimensions of its patients. And so that's called the biopsychosocial model. That's the systems view for medicine. And so this investigative body, it could be a federal commission or a presidential commission, will investigate medicine to see how well it is adhering in its education to modern scientific systems-based concepts. And it will be found, as you're hearing from me, severely wanting. They then will make recommendations for what needs to happen to bring medicine into the 21st century and start addressing the person that they're taking care of and their social aspects, as well as their physical diseases. And this will be overseen by a group, I call it a National Institute for Health Education. Don Berwick has called it a Health Accountability Board. This will be a federal group that oversees implementation of biopsychosocial education and practice throughout medicine. And they will have authority to enforce that both fiscally and through other measures. So there is a way out of this. We simply need to get the public informed, activate the politicians, and then do what I've just said.
I'm glad that you have a solution.
It's easy to complain, but you have to have a solution.
Great. Are you a little bit hopeful? At least I know I have been. I don't know how long it's been. It's not that long, but a lot of doctor offices now are giving out the PHQ-9, which is a measurement for depression, and it does ask about suicide.
Yeah, no, I think it's critical to do that. It is one way to raise doctors' awareness to the fact that the patient may have a mental disorder, and in particular, whether they are suicidal or not. Now, doctors aren't trained in suicide, and what I recommend to them is once somebody checks that off on that box, make sure they go immediately to the emergency room or to a psychiatrist. Don't send them home. Don't let them out of your sight. They go directly to other care.
Yeah, I wish more doctors had the suicide training, because sometimes a
Yeah,
client thought about suicide 2 years ago, they check off the box and then they show up at the ER.
yeah, yeah.
So there's still a lot of work to be done, even with the PHQ-9.
Oh, lots and lots. I'm
Yeah.
glad to hear you using the PHQ-9.
Oh yeah, I use it very frequently in my work. I
It's a
use it's a
good,
chart. Yeah,
yeah,
I also use the GAD and the PCL
yep,
for PTSD.
yeah.
Yeah. We got to wrap up here soon, although I don't want to. You're a wealth of information. Tell us what you love most about your latest book. Like, what chapter or what part of it did you love writing about the most?
It's this final chapter where much of what I was talking about just now is expanded upon considerably, but it's how to solve the problem. Easy to complain. Here's how to solve it. The public has to become involved and angered at how poor their care is. And we haven't even talked about it's wasting into the trillions of dollars by not addressing these problems. Think of prevention. If you could prevent 80% of all of the main problems that are in hospitals today, you'd save a ton of money. And it's been estimated to be in the $2 to $3 trillion a year, but medicine doesn't do it. The other thing I would encourage, people need to get angry about how poor mental health care is. Many of them don't really know it. And this is what I'm trying to get across. On my website, it's robertcsmithmd.com. And don't forget the MD. I have a common name and you won't find it without that. But it's robertcsmithmd.com. On the very first page, when you click on that, there's a section that says Act Now. This will take you to a sample letter. It also has the email addresses of the president, the surgeon general, the National Academy of Medicine, as well as your congresspeople and your senators. You simply paste that letter into the email and send it. Also, and Karen, you would be a good example. Add your own paragraph in there about how it's affected you personally. But this is the way for people, individual people out there, to have some input into what's happening. This is the way to take charge.
Yeah, people do better with mental health too when they take action.
Yeah, we
'Cause
do
then
have some control.
yeah, we do have some. You're right. Okay, like I said, I hate to end, but we must. Thank you so much, Dr. Smith, for being here today. And I look forward to hearing you speak more on this very important topic at the summit.
Oh, thanks for having me, Karen. And thank you for all you're doing to raise consciousness for the mental health in general and trauma in particular.
Thank you.
Thank you for listening in today. Please join us next week, same day and time. Also, I would love for you to check out my website, healthrivedream.com.
Are you a woman on a mission to uplift the lives of other women through your business? Do you have massive value to bring, and yet you still have difficulty gaining new clients? If so, join me, Katerina Rando, at my next free virtual workshop. I show women how to sell authentically to achieve sales bliss. Visit katerinarando.com/links to sign up for my next free workshop and gain many additional business building resources. Bing, bing, bing.